There are a number of ways that national organizations can work with Black harm reductionists who are working on a multiplicity of issues. We identified 2 organizations that really worked on issues that had been identified during our convening as critical in terms of tools to engage policymakers and engage the community on the impact of overdose and how overdose intersects with other issues that keep a community unwell. We identified Policy Map, which is a GIS mapping organization. What Policy Map brought to the table was a way to help advocates create a picture of the community that would demonstrate how interconnected these issues were, and that you couldn't single out drug use and drug users from the rest of the fabric of health of the community. This appealed to many of us at the Black Harm Reduction Network convening because painting a picture of the community where drug use is happening, where drug users live, where drug users use was critical in terms of building community support for the kinds of health interventions that people who use drugs need to stay healthy. The Advocacy Institute is a resource that we wanted to make available to local advocates and grassroots organizations because they are frequently not represented in the places where decisions are made, whether it's the state capitol, it's the city council, it's the mayor's office. Not everyone is absolutely sure of how to be an effective advocate. Advocacy Institute takes a very systematic approach to demystifying the policy process, whether it's about getting a piece of legislation passed, trying to get an allocation in the budget, or engaging a policymaker to support or even oppose an issue. The Advocacy Institute puts those skills into the hands of the organizations and individuals who know their community best.
If you're someone who's a Black harm reductionist, Black drug policy reformer, I think part of the conversation is getting connected and building networks and relationships with other people that have been in the field. And then also, who are the drug policy harm reductionists that are in our national organizations currently? Introducing yourself, figuring out how we can leverage the resources in these bigger nonprofits to provide support either through talking or technical assistance, or figuring out how to ways for us to do collective donor mapping and fundraising. And then also, I think, how do we as a collective get people to recognize that the issue of drug policy reform and harm reduction is a racial justice campaign that should be funded throughout. And I think a lot of that is going to be conversation and planning together.
To learn more about the Black Harm Reduction Network, please go to Legal Action Center's website.